Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper, or is basically all the four quadrants. We can see we've got a bilateral edentulous area distal to the first premolars in the lower jaw. We've got a BDR present in the upper left canine region, and we've got a cantilever bridge on the upper right hand quadrant. Now, we've placed virtual implants, but at the same time, we're going to take you through the CBCT with each and every angle and element of this tooth. So if we are looking at this particular area, this is just two thin ridge. Basically, we've just got 4.5 mm of ridge with approximately 14 mm of ridge height. Moving to the more distal aspect, which is the molar region. The molar region, the bone seems to be more appropriate. The bone quality here is D4 because we can see absolutely no cortical plate and very elaborate cancellous bone, but we've got very good bone ridge and bone height. Under the cantilever, we've got 6.3 mm of bone width and approximately 14 mm of bone height. Moving to the distal aspect, which is the second molar region here, the bone ridge again appears to be very thick and wide, but again the bone quality is very, very poor. You can clearly see that this is D4 quality of bone. We've got 8.2 mm of width with 17 mm of ridge height. Moving to the lower aspect, so this is the first premolar region. In the first premolar region, again, we've got slightly thin bone, but better than before. We've got approximately 6.4 mm of ridge width with approximately 15 mm of ridge height. This is D2 quality of bone because we've got good cortical plate and we've got cancellous bone. If osteodensification burrs can be used, so this ridge can even be slightly more increased in width by 1 to 1.2 to 1.5 mm of width. Moving to the second premolar region, we've got again relatively good bone, which will measure approximately 6 mm just below the crest of the ridge and approximately 10 mm to the inferior alveolar nerve, which is marked by orange here. Moving to the first molar region, we've got the bone dips. We've got very short bone. The ridge width is very good, but the ridge height approximately is just 9.2. So shorter implants will need to be placed here. Moving to the top left hand, this is the canine region. You can see that this is root canal treated, and we don't see periapical pathology, but this is a BDR, and we've also placed an implant virtually here. Moving to the lower left, first premolar region, we've got relatively good bone. There we go. So we've got relatively good bone here, D2 quality, 6.7 mm of ridge width with approximately 12 mm of ridge height to the mental foramen. The second premolar, the bone dips a little. The ridge width, it's nice, but the ridge height approximately is just 9.6 mm to the inferior alveolar nerve. Something to note in this region is, on any mandibular region, is that the ideal scenario, we will need 2 mm of space between the apex of the implant and the inferior alveolar nerve canal, but that can be reduced to 1 mm, but we will advise that caution needs to be taken in the posterior mandibular region of this patient. The molar region, again, the ridge widens, but the height definitely decreases. We've got approximately, sorry, 8.3 mm of ridge height in this and approximately 8.4 mm of ridge width. So this is how the tooth looks. Now we're going to place all the implants, and then our kind doctor can evaluate how they look. So these are all the iris solution implants that we've placed. Again, this is a virtual implant planning. The amount, number and position of the implants can definitely be reduced. The number of implants can be reduced. The position, this is the most ideal position that we have evaluated based on the CBCT. We are willing to discuss this case with the doctor if they need any further guidance. So this, I'm just going to take you through each implant on the transaxial view. This is the lower implant. Here you can see we've placed in a 6.5 mm of ridge height. Then moving to the Second molar, the red here shows that this implant, despite its shorter height, is extremely close to the inferior alveolar nerve. This is a red that the software has highlighted. This is the first premolar implant, which again shows that this is definitely very close to the nerve. If we slightly change the position, we might be able to, or we can just shorten the implant by a couple of and we will see that the implant gets a little better in its position. There we go. It's still red. That means there is still vital structure associated with it. Moving to the upper left quadrant, we can see that the implant can be placed immediately post extraction of the canine, but bone augmentation on the buccal hand side will definitely be needed. The lower right hand quadrant, so this is the first premolar implant. This, even though the ridge was thin, we've placed a very thin implant here. So this implant is 3.3 in its diameter. Moving to the first molar and second premolar region, a 6.5 of height and 4.1 of ridge of diameter. This is again a 4.7 and a 6.5 again, with the red showing that this is extremely close to the inferior alveolar nerve. So caution will need to be taken. If we can change the angle, we can clearly see that the change in angle has given us red. The red mark has definitely gone away. So this is the top bottom right, and the top right here we can clearly see. There we go. So the bottom right, the second molar, we've got the best bone in this region. The second molar can be placed in very comfortably. This is a 4.7 and a 11.5 of height, and this is a 4. This one is the way the cantilever is. It's a 4.1 and 11.5 implant. So has been a very extensive video. We will also share the implant planning report. If there are any further questions regarding this case, please feel free to reach to our team. We will be extremely happy to help our doctor plan this case however help they need. Thank you very much.